Hey everyone, my name is Mario.
And I'm Nicole.
And today we're at Huhuka Memorial Hospital at our physical therapy department. And we're going to be taking a look at our newest expansion here in the department. So we're going to be meeting some of the staff. We're going to be taking a look at the new equipment and talking about their services that they offer our patients. So let's go meet some of the staff and learn more about the team today.
Let's go.
Hi everybody, my name is Angie Downs. I'm the Director of Physical Therapy, and we're going to take a look at our new building today. We finished our expansion project last November. So with that, we added about 3,000 more square foot of space. So that's more space for patients, more space for all the therapists to do all of their treatments. We added a pool, we added a ZeroG gait and balance system, we added a lot of new equipment for all the staff to utilize. Physical therapy, we have 3 current locations where we see patients. The first location is here, which is at Sackatoon or Huhuka Memorial Hospital. We also have Comont Health Center, and we also have Red Tail Hawk Health Center. So patients can make an appointment at either one of those locations, whatever is most convenient for them. We currently have 9 physical therapists between the 3 locations. We have 5 PT technicians who help support the PTs and the patients with the patient care. And we have 3 department support, office support schedulers that do all of our scheduling, ordering, and admin duties. So we offer any kind of services to treat low back pain, knee pain, or any other joint pain. We treat chronic pain. We also have pelvic health, men's and women's. We do aquatic therapy. We do gait and balance training. We can pretty much treat anything. The providers know they can call and ask if they have questions. And if it's something we can't do, we'll help them find somewhere that might be a better fit. But we can do most of it all here.
For our new patients, how are they referred or how do they make an appointment?
So in order to get seen in physical therapy, they'll need a referral from either their primary care physician or their walk-in provider. They can come to the walk-in clinic or make an appointment with their provider or outside provider. And once they get that referral, the referral either gets sent to us or they can bring it to us and they can come schedule, they can call us to schedule, and that's all they need to do.
For our first-time patients, what can they expect on their first visit?
So the first appointment is kind of what we call an evaluation. So they get to speak with the therapist. The therapist takes a subjective history of their current problem or issue and what they want to work on and what their goals with physical therapy is. Do some testing and measures to see what they can diagnose from that, and then develop a treatment plan that the patient can have moving forward. Some of our physical therapists can do specialty things, including vestibular therapy, pelvic health, which is your pelvic pain or urinary incontinence. We can treat hand pain, hand fractures, and we can also do sports and orthopedic, whether it's an adult or pediatric population.
Well, Angie, thank you for all that information. It was great. It was good to see you.
Hello, I'm Annie Kane. I'm one of the physical therapists here at Gila River Healthcare.
So, hey Annie, so one of our new pieces of equipment is here at HHK, and maybe tell us a little bit about it.
So this here is the ZeroG. The ZeroG is a body weight support system that helps offload body weight in a reduced gravity environment. So it can be great for people with neurological conditions such as Parkinson's disease, stroke, or even orthopedic conditions where we want to offload some of their body weight so that they can walk without pain or have less risk of falling.
How does this piece of equipment might help our patients in their overall treatment plan?
I think in their overall treatment plan, it can help somebody build some confidence because the harness is safe. It can help reduce risk of falls because it's going to catch somebody if they lose their balance. It's going to help offload them so that they have less pain when they're walking. And we can dial that percentage of offloading up depending on what they need. And we can practice a lot of functional strengthening here. Things like step-ups, things like squats, some balance training, some gait training. They can walk the track in it. There's a variety of different options we can do with it. I have a couple of success stories of where somebody maybe has a fracture and they're in a period of non-weight bearing. And so as we start transitioning them from long weight bearing, not weight bearing for a long period of time, and then moving them to putting some weight on, this can help build confidence because we can offload some of their body weight. So maybe we're taking 20% of their body weight off so that they can work on building strength and feeling more confident in the harness. So as they build that strength and then we get them outside of the harness, they have that confidence established and they can do a lot more walking and doing, sit to stands and that type of stuff with more confidence after training with this.
It sounds like this piece of equipment is really beneficial to our patients and also the clinic.
Yep, it's a great aid to help improve gait training, improve balance, help improve strength, and walking endurance while in the harness.
Great, well, thank you for your time. We appreciate it.
Hi, my name's Leanna Merrick. I'm a board certified pelvic health physical therapist. And can you tell us a little bit of what is the pelvic health physical therapy? So pelvic health physical therapy deals with issues below the belt. First off is bowel and bladder dysfunction, so issues with leaking urine when you cough or sneeze, or difficulty going to the bathroom. If you go to the bathroom really often or you feel like you have to go really often, constipation is another thing. I also can help with abdominal or pelvic pain. One of the other things is issues that come up during pregnancy, such as round ligament pain, low back pain, SI joint pain, as well as issues with postpartum, such as C-section scarring. I treat adults of all genders. Everybody has a pelvis, everybody goes to the bathroom. So I definitely see all genders. I would say the top 3 things that I treat are, 1 would be stress incontinence. A lot of women I see have issues leaking when they exercise or run. So helping getting patients back to doing exercise safely and without leakage. Number 2 would be constipation. So a lot of times people who have urinary dysfunction also have bowel dysfunction. So making sure we're talking about diet, movement, water intake, things like that. And the 3rd thing that I see most often is actually painful intimacy. So pain with intercourse can be treated with physical therapy.
Patients get a little bit hesitant coming in and maybe feel like, oh, where am I going to be set up at? Is it in a private area? Where is your office located?
All of my treatments are performed one-on-one in a private treatment room. The only exception is if we need to use any of the exercise equipment, such as like the treadmills or the weights. But for the most part, 95% of the session is going to be in a private treatment room.
Hello, my name is Taylor Davis. I'm a physical therapist here. So recently we got an expansion that includes the pool. So our pool is a 30-foot in length by 12-foot in width pool. It has a depth of 5 feet on one side and transitions into a 4 feet on the other side. Pool is one of the many tools we have at our facility to help our patients and our community with certain impairments. The pool specifically is made for patients who have difficulty or pain with ambulation, or they may have a lot of dependence and difficulties with getting out of bed or getting out of chairs. The pool utilizes the property of water to aid in those functions. Our pool includes stairs to get into it, and there's also a lift that allows patients who are more wheelchair dependent or lack the mobility to utilize stairs.
That is awesome. And then what should the patients expect, like the safety measures and the function of the use of the pool?
So we do our very best to ensure patient safety. We have 2 staff members in the pool at a time to ensure that they're afloat and feeling comfortable. We also have a criteria that we allow the patients to go through in order to ensure that they're indicated for the pool. We will also get referrals from the provider, and that'll allow that all of their cardiovascular health, other systems of the body are able to accommodate being submerged in the pool.
All right, Taylor, and then I know for some of the first-time patients, what should we expect when we come in, and what do we wear when we come in?
Typically, on the first day, it's a lot of introduction. We have the patients bring swimwear with whatever they're comfortable in. Most of the time, patients wear long sleeve shirts, short sleeve shirts, shorts, whatever they're able to feel comfortable and confident in. And we have a locker room for them to change. We provide towels, and we also provide showers. So everything that's required is here at our facility, and we are happy to talk more about the details during that first visit.
Well, thank you, Taylor, so much for everything, and I know that we appreciate it, and we can't wait to see you guys.
Of course. We're happy to have the community aboard.
So big thanks to our physical therapy team for all the information that they shared today. If you have any questions or want to make an appointment, please give us a call and we'll be happy to help you. So until then, have a great day.
Bye, guys.